I loved science and I loved people. And so it just made sense for me. I enjoy surgery, I enjoy being in the office, but I love to talk to people. And that's why I love OB/GYN. It actually mixes everything up, so you have a little bit of all three of those aspects. My youngest patient has probably been about 10 or 11, and my oldest patient's about 93. So everything in the middle. And what's great is I see patients starting in adolescence or teens just for general GYN issues, and then may follow them through obstetric times and their reproductive years, and then seeing them through perimenopause and menopause and managing those issues that come up. It's definitely one of the highlights of my job. They come in when they're newly pregnant. We do an exam, get their history, do an ultrasound, spend a lot of time talking, spend a lot of time educating them. And then you see these women very frequently, 8 to 10 times over the next several months if everything's normal, until their delivery, and then even after postpartum we see them. The most important thing is to talk to a patient like they're a human being, because they are. Talk to them like you're their friend, but also giving them important information, but I think that makes them comfortable. Oftentimes we spend so much time on computers and electronic medical records that people don't sit and talk eye to eye, and I think one of the things I've always done is spend time talking to the patient, looking at them face to face, dealing with that paperwork stuff later. And that really, I think, establishes a bond that has helped my practice be successful. I've been doing this for a while now, and so there are patients that I've seen before they were married, once they're married, and then they're having babies, and I get to see them afterwards. They become like friends when I see them at annuals, and I really enjoy that part. Majority of what I do is happy, but there are things that can be very serious and really tough for families, and I love being a part of that.